And for the next up, we are talking about a linkage between another disease condition and heart failure. So this disease condition that we are looking at is acute glomerulonephritis. So we first of all understand the topic before we go into discussion. Glomerulo looks like glomerulus. Itis looks like what? Inflammation. So of course there's an inflammation of the glomerulus in the kidney. So some of you guys will be asking that an organ as far as the kidney, how can it be able to cause heart failure? So let's establish the linkage between these two conditions. So acute glomerulonephritis is a kidney condition. In severe cases, it leads to heart failure in children, especially when complications like the kidney is not filtering out fluid properly again. So you have a backlog of fluid in the body, so the heart has to deal with what? Too much fluid. Do you understand? So let's define it properly. Glomerulonephritis, just like I told you guys, is inflammation of the glomeruli or glomerulus. Okay, those are the tiny filters in the heart. It often follows infections, so most of the times it's infections that is causing it to inflame, and this leads to what? Kidney function declining. Okay, so how does it actually lead to heart failure, which is the link we actually want to establish? So for glomerulonephritis, damaged kidney makes it that fluid is not being taken out of the body as it should. So you have a backlog of sodium, you have a backlog of water. So this causes edema, hypertension, increased preload on the heart. So the heart may struggle to pump the excess volume. Do you understand? Like the heart has too much fluid to deal with. Alright? So this could actually lead to what? Congestive heart failure. The heart is clogged up with too much volume of fluids. Another reason could be hypertensive crisis. So this acute glomerulonephritis often causes severe hypertension. Your blood is flowing on a very high speed. Okay, now this is due to fluid retention and activation of renin-angiotensin system. So high blood pressure increases after load, making it very hard for the heart to be able to put out blood. All right, so it could lead to left ventricular failure and pulmonary edema. So electrolyte imbalance too. So hyperkalemia, potassium levels is shooting, causing acidosis. Impairs how the heart is conducting and how the heart is contracting. Okay, so there's a risk of the heart beating abnormally. Okay, so uremic toxins. So in severe cases, acute kidney injury develops. There's accumulation of toxins like urea in the body. Okay, so if it travels to the heart, it causes the heart muscles to become what? Depressed. Okay, contributing to uremic cardiomyopathy. Okay, so let me also get that. Okay, so that's it. That's a linkage between kidney issues and heart failure.